My name is Alessandro Berionni. I am the chair of Young World Federation of Public Health Associations Working Group. I am a newly medical specialist in public health, just since 2 weeks, so very freshly. I'm from a small town in the middle Italy and living also in Rome. And I was also coordinating the previous international students meeting on public health that took place in Rome during the World Congress on Public Health. And what else about myself specifically? I'm a classical pianist. Sometimes I like to say that since we often talk about work, and this is a more of a let's say spicy note. Really am a huge fan of the synergetic approach. I don't know. I see lots of public health action sometimes happening in silos, not with bad intentions, but sometimes I feel like we would need more sort of synergetic action, collaboration, and less duplication of activities, or even more coordinating in the sense of driving actual change, pragmatic change. This is something that could come from a synergetic approach and more coordinated with a non-government organization, with the government organization, and so on. So I don't know. I feel this is also a word that is very much used in the public health field, either for the One Health description definitions, the planetary health definitions. But I really do believe that we need more type of interdisciplinary, intergenerational, inter how can I say institutional approach, because it's something that I feel like sometimes is very missing at the moment, even though the efforts are going in that way, but it's a key component for an actual transformation towards a real change. I think that having new partnerships after the new type of collaboration after the Congress will be a great outcome. And this will be an actual change that will mean for me when I will come back home. I think that also on the other side, the actual change needs to start from delivering local, I can say local change more than, because most of the times as global organization, we are talking about global agendas, international affairs, issues, and so on, which is really much important. And this type of approach is also really relevant to delivering and addressing this type of issues. But sometimes we do neglect and forget about the local change. And this is something that honestly, I would really like to have in my mind once I come back after this World Congress. Again, it's a World Congress, so it's a bit paradoxical, but I would love to see how local change can really happen through possibly these universal and world lenses. But I think it will be really useful because most of the times this type of local change can also inspire and get imitated by other countries or realities, not only in low middle income countries, but also in high income countries and so on. And this is something I think is really much needed in terms of scaling innovations for driving change across the world. Yeah, but sometimes it's not easy to achieve that. So it's very also utopistical sometimes. So last conference happened in 2023. We were living a very different scenario in global health, and I would say in geopolitics. So it was the COVID aftermath. There were actually the title of the previous conference was the word in turmoil, if I don't get wrong, word in a turmoil, yes. And it was very much meant for those years. I think that right now we are still living this type of vibes. So we are still have this taste of turmoil in our mouth. But at the same time, I feel like a bigger issue coming up, which is the lack of trust and the lack of, I would say, lack of trust in institutions in general, either national or international. And secondly, also the sense of democracy shredding, which is concerning on a certain way, in a certain way. And I'm saying these connecting to the previous conference, since the last one had very much point sessions and reflections on how to address the turmoil, the emergencies, and this type of the misinformation, pandemics issues, how we could address them. Now, I feel like most of these approaches have been initiated. For example, there are many agendas and initiatives trying to address the misinformation, lots of talkings about AI and how the new technologies need to be driven in a more ethical and aware way. But even though I see like some of these approaches moving on, for example, also from the United Nations, so and from the NGOs, there's lots of talks from this type of topics. But at the same time, I feel like there are more impelling priorities that we should try to shift to. And this is something that I would like to see more focus on, which is again the lack of trust in institutions and the way of engaging the actual individuals in this type of discussions. I feel this connection between organizations and actual individual and population has not been how can I say, has not been maybe investigated enough so far. So this will be something that I think a shift might be needed in a more transformative way for the new Congress. I know it's happening in a let's say in a African country, South Africa. So I think the topic of inclusion, health equity are very much needed, and it's I feel I do much agree with the title of Health Equity Without Borders, and it's something really much reflecting with my thought on needing to a more engaging participation or civil society individuals and so on in the global scenario. But yeah, most of the actually issues and priorities are also still there. So the climate stress, the youth leadership has been also pointed out in the last conference, and we would like to have a more seen in this type of conference because we're doing a lot as young WFPHA. But yeah, there are still so many topics and issues that are still up there. And now we need to face also with many ones, many more others. But I expect more in a participatory and a more regulatory way, the change. That's what I kind of expect to. We've been traveling to Taiwan, to Taipei in August 2025. And I was literally stunned by the way they were addressing some issues and problems that we were addressing completely different way. So this is, I think, an example that speaks loud. Most of the times we just need we actually step into innovation just by looking at what other people are doing so that we can either copy the approach or we can just do something similar, have some new ideas. And what I would think would be very useful from an African World Congress would be learning more of addressing issues, public health challenges through community approach, which I think is gonna be way more, how can I say, strong approach compared to European ones, more collective and community based. And on the other side, I think it will be also very interesting discovering and investigating more on the low resource approach. Most of the times we're looking for, I don't know, strong high tech innovation, cutting edge innovation for addressing like any type of issues. But I think that public health sometimes needs some sort of social low resource innovation that can be done easily. So I think this type of conference in South Africa could really provide good insight on from this perspective. And secondly, I also think that the different inequalities that are present in South Africa could also be very good much a very good insight for a regional reproposition of topics, understanding how some inequalities issues are addressed, how fix some of those. So I think that these are the two main topics that could be very interesting to explore more. As I said, first of all, the community-based approach for public health challenges addressing. And secondly, yeah, the health inequalities analysis, understanding, and the solutions that they're already handling. So, as I was saying, I think the most urgent call that issue that we are living nowadays is first of all the mental health concern as we saw the huge focus from the United Nations of this year, the UN high-level meeting on that, the misinformation and the algorithmic lack of regulation, and thirdly, the political polarization. These three topics, I think, are all interconnected because they all have some sort of common ground and reasons why they are up there. Why I'm saying this, I know that this type of discussions looks very political, but I think they have a very strong influence on the public health scene, on the public health outcomes in general, health outcomes in general. So as we know, we call it most of the times determinants of health. We can define it as political determinants of health, as digital determinants of health, or whatever. But the thing is that these three main points are really needed to be addressed. So I would really like, and I would really like to call for that, as I was saying, to bring a decisive shift from intention and advocacy to actual implementation for and addressing for this type of issues. So we should find a way of driving, as I was saying also before, local initiatives, local innovative ideas that actually address those specific challenges in a small controlled environment. And there's maybe this could be scaled up and reproposed in other environments. I know that this is very idealistic, especially when we talk about these big issues that requires big solutions, especially when we talk about algorithms, political polarization. But I kind of find interesting the way of seeing the solution in the small and local approach rather than in global. We have tried to act in the last 10 years or maybe even more in the other way around. So starting from the global approach to the local, but some sort of concerns and issues have been raised, as we saw, and they were not effective. So I'm not saying that we should give up with them, but maybe it's time to reinforce this type of global to local approach with a parallel and ongoing local to global approach. And I think this is something that's really missing. So I know this is also very much theoretical. So I'm not actually driving some type of actual implementation, actual change in that way. But I think that's maybe the best call and urgent example that we can provide to people would be, let's start doing something concrete and actual. So let's launch an initiative that drive local change. Let's find a way for this World Congress to show concrete results for South Africa, for other African countries that are taking part to the World Congress. And let's find a way to make them happen in every national public health association if they want to. I think this would be very interesting as also has outcome for the World Federation and for the actual World Congress and for myself and for every national public health association. We need to cooperate more and make these local challenges addressing more concrete and more cooperated. So yeah, I would say just let's be creative and let's make it local for scale it up later.